Hi, my name is Amanda Steiner, and my presentation is on congestive heart failure. Congestive heart failure is the disease of the heart characterized by shortness of breath, edema, and weakness. In congestive heart failure, the ventricles, specifically the left one, are damaged. As a result, the heart as a pump fails. The heart then attempts to compensate for that by increasing your heart rate. As a result of inadequate pumping by the heart, fluid backs up into the body. CHF is a chronic condition in which the heart doesn't pump blood as well as it should. There are two types of congestive heart failure, right-sided and left-sided. Left-sided heart failure is caused when the left ventricle fails, which increases the fluid pressure, which is then transferred back through the lungs and ultimately damages the heart's right side. The left ventricle supplies most of the heart's pumping power, so it's larger than the other ventricles and essential for normal function. In left-sided heart failure, the left side of the heart must work harder to pump the same amount of blood. Right-sided heart failure usually occurs as a result of left-sided heart failure. When the right side loses its pumping power, blood backs up into the body veins. This causes swelling or congestion in the legs, ankles, and also swelling in the abdomen. The swelling caused from right-sided heart failure is called dependent edema, meaning swelling towards the lower part of the body, such as the legs and ankle. Some causes of CHF are diabetes, which increases your risk of high blood pressure and coronary artery disease, obesity, valvular heart disease, congenital heart defects, which individuals are born with, and sleep apnea, which is the inability to breathe properly while you sleep at night, which results in loss of blood oxygen levels and increased risk of abnormal heart rhythms. The two most common causes of CHF are coronary artery disease and hypertension. Some signs and symptoms of congestive heart failure are fatigue, weakness, rapid or irregular heartbeat, reduced ability to exercise, swelling of your abdomen, persistent cough or wheezing with white or pink phlegm, increased need to urinate at night, very rapid weight gain from fluid retention, lack of appetite and nausea, and difficulty concentrating or decreased alertness. Next, I'm going to talk about the 4 stages of heart failure. Stage 1 is considered pre-heart failure, which means that you are at high risk for developing heart failure because you have a family history of heart failure or you have one or more of these medical conditions such as hypertension or diabetes. Stage 2 is considered pre-heart failure, which means that you have been diagnosed with systolic left ventricular dysfunction but have never had symptoms of heart failure. This stage includes anyone who has heart failure due to any cause. Next is stage 3. Stage 3 is for patients who have been diagnosed with heart failure and currently have or have had signs and symptoms of the condition in the past. Lastly is stage 4. Stage 4 is defined as the final stage of heart failure. This is a patient with advanced symptoms that do not get better with treatment. When it comes to any kind of treatment for congestive heart failure, the treatment can help you live longer and reduce your chance of dying suddenly. Some medications that are used as treatment are ACE inhibitors, which are used as a vasodilator, which widen the blood vessels to lower your blood pressure, beta blockers, which slow your heart rate and reduce your blood pressure, diuretics, which are called water pills, which make you urinate more frequently to keep fluid from collecting in your body, and a medication called lanoxin, which increases the strength of your heart muscle contractions. There are many ways to prevent your chances of congestive heart failure. Some of these include quitting smoking, limiting your alcohol or fluid intake, limiting your saturated or trans fats in your diet, following a heart-healthy diet, sticking to a healthy weight, getting regular physical activity, at least 30 minutes a day, getting enough sleep, and reducing the amount of stress in your everyday life. This slide shows some stats along with a picture that shows the heart failure death rates from 2013 to 2015. When you look at ways to prevent it, it's all easy tasks. All it takes is a little change to prevent heart disease. The dark red in the picture is the highest average, which you can see is plentiful on the map. It shows how many people in the U.S. alone have died from heart failure in those 2 years. This last slide marks the end of my presentation. This is actually a collage of myself during some of my dance competitions and conventions. Thank you so much for watching.